Have you ever experienced that burning sensation rising in your chest after a meal? It's uncomfortable, frustrating, and often leaves you searching for relief. What if we told you there's a natural remedy that tackles this problem at its core without the need for meds? Intrigued? Today, we're diving into the #1 remedy for heartburn that you've never heard of and will help you forget about this issue. Welcome to Levitas. Heartburn is a common condition characterized by a burning sensation in the chest, usually after eating, lying down, or bending over. It occurs when stomach acid flows back into the esophagus, the tube that carries food from your mouth to your stomach. This backflow of acid, known as acid reflux, irritates the lining of the esophagus, causing discomfort and that familiar burning sensation. Despite its name, heartburn has nothing to do with the heart. The sensation is called heartburn because the discomfort is often felt in the chest, near the heart. Heartburn can range from mild to severe, and is a symptom of acid reflux or gastroesophageal reflux disease, also known as GERD, when it occurs frequently. Occasional heartburn is common, but when it becomes chronic, it can lead to more serious health problems. Acid reflux occurs when the lower esophageal sphincter, a ring of muscle at the bottom of the esophagus, doesn't close properly after food enters the stomach. When the lower esophageal sphincter is weak or relaxes inappropriately, stomach acid can flow back up into the esophagus, leading to the burning sensation associated with heartburn. Several factors can contribute to acid reflux. Diet plays a significant role. Spicy foods, high-carb foods, fatty foods like junk food, caffeine, chocolate, and alcohol are common culprits. Obesity and pregnancy can increase abdominal pressure, pushing stomach contents back into the esophagus. Additionally, smoking and certain medications, such as antihistamines, calcium channel blockers, and antidepressants, can weaken the lower esophageal sphincter, making acid reflux more likely to happen. Even stress and lack of sleep can contribute to the frequency and severity of acid reflux episodes. While occasional acid reflux is usually harmless, chronic acid reflux, or GERD, can lead to more severe health issues. Over time, the repeated exposure of the esophagus to stomach acid can cause inflammation, leading to a condition known as esophagitis. This inflammation can result in symptoms like difficulty swallowing, persistent cough, and chest pain. In more serious cases, chronic acid reflux can lead to complications such as esophageal strictures, where the esophagus narrows, making it difficult to swallow food. Another potential complication goes by the name of Barrett's esophagus, a condition where the tissue lining the esophagus changes and can increase the risk of developing esophageal cancer. Therefore, managing acid reflux effectively is crucial to prevent these long-term health problems. What is the #1 remedy for heartburn? When it comes to managing heartburn and acid reflux without medication, one remedy stands out: betaine hydrochloride. But what exactly is it? How can it help, and how much to take? Betaine hydrochloride is a chemical compound that is a form of hydrochloric acid, combined with betaine, a naturally occurring substance found in foods like beets, spinach, and grains. In the context of heartburn and acid reflux, betaine hydrochloride is used as a dietary supplement to increase the level of acid in the stomach. This might seem counterintuitive since acid reflux is commonly associated with too much acid, but in reality, one of the main causes of acid reflux is often too little stomach acid. Low stomach acid, or hypochlorhydria, prevents the lower esophageal sphincter from closing properly, allowing acid to escape into the esophagus. By supplementing with betaine hydrochloride, you can help restore normal stomach acid levels, improving digestion and reducing the likelihood of acid reflux. Betaine works by increasing the acidity of the stomach, which in turn helps to improve digestion and close the lower esophageal sphincter more effectively. When you eat, your stomach produces hydrochloric acid to help break down food, especially proteins, and absorb essential nutrients like vitamins, minerals, and amino acids. This acid also serves as a barrier against harmful bacteria and pathogens that might be ingested with food. In people with low stomach acid, food isn't broken down properly, leading to bloating, indigestion, and a greater chance of acid reflux. By taking betaine hydrochloride, you can boost your stomach acid levels, aiding digestion and reducing the symptoms of acid reflux. Moreover, proper stomach acid levels help to signal the lower esophageal sphincter to close after eating, preventing stomach contents from flowing back into the esophagus. By now, you should be considering betaine hydrochloride as a remedy for heartburn, but remember it's important to use it correctly. The supplement is taken in capsule or tablet form with your meals. It's recommended to start with a low dose, such as one capsule containing 50 to 100 milligrams of betaine hydrochloride with food. While you eat, you can gradually increase the dose until you feel a warm sensation in your stomach, which indicates that you've reached an adequate level of stomach acid. However, it's crucial to take betaine hydrochloride under the guidance of your healthcare professional, especially if you have a history of stomach ulcers or are currently taking medications like non-steroidal anti-inflammatory drugs or corticosteroids, which can increase the risk of stomach irritation. In conclusion, heartburn, a condition marked by a burning sensation in the chest, is a symptom of acid reflux that occurs when stomach acid flows back into the esophagus. This discomfort arises when the lower esophageal sphincter, a muscle at the bottom of the esophagus, fails to close properly, allowing acid to escape. Diet, lifestyle factors like obesity and smoking, and certain medications can weaken the lower esophageal sphincter, making acid reflux more likely. While occasional heartburn is common, chronic acid reflux can lead to serious health issues, including esophagitis, esophageal strictures, and Barrett's esophagus, which can increase the risk of esophageal cancer. One effective natural remedy for managing heartburn without medication is betaine hydrochloride. This compound, a form of hydrochloric acid combined with betaine, helps increase stomach acid levels, which can be surprisingly beneficial. Many people mistakenly associate acid reflux with excess stomach acid, but in reality, low stomach acid can prevent the lower esophageal sphincter from closing properly, leading to reflux. By supplementing with betaine hydrochloride, you can restore normal stomach acid levels, improve digestion, and reduce acid reflux symptoms. Betaine hydrochloride works by boosting stomach acidity, aiding in the proper breakdown of food and absorption of nutrients, while signaling the lower esophageal sphincter to close effectively after meals. To use this supplement, start with a low dose and increase gradually, ensuring you take it under the guidance of a healthcare professional, especially if you have a history of stomach ulcers or if you are using specific medications. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So stay healthy, stay happy, and keep going.